Hey guys, it's Dr. Anthony Davis at the Davis Medical Group and Body Goal MD. Today we're going to talk about something that's so common. We talk about this almost every day in the practice, and that's hair loss. Hair loss. It's such a simple thing to say, but such a complex thing to talk about. Hair loss is dramatically misunderstood. It's very difficult to diagnose at times. It's a little bit of a head scratcher, pardon the pun, but we're going to get to the nitty gritty and we'll talk about hair loss here in this video today. So stay tuned. Nothing is more upsetting to men than starting to lose their hair. Trust me, that's why I always face it this way in these videos, because I'm a little self-conscious, but you know, it happens. So there's a certain amount of hair loss that is pre-programmed genetically. It's genetics. Even more traumatic is when a woman starts losing her hair, because goodness, how often do we define a woman by her beauty and her hair? So it can be quite scary. In fact, I hear this all the time. And a lot of times I'm just kind of like, well, this is a complex problem. Let's go to the dermatologist. Let's do this, let's do that. But you can actually take this and take a scientific approach to it. And so we want to determine why you've lost your hair. And to make it even more complex, it can be hormonal, or it can be genetic, or it can be stress-induced, or trauma-induced, or infection-induced. Goodness, even a high fever can be enough to make you shed hair. So let's kind of go through all the basics. So basically, we break it down into different types of hair loss. You can lose hair in two primary ways: in patches and distinct areas, focal areas, spots, small areas that maybe don't have a pattern to it, or a pattern loss, or a diffuse all over loss. If you're losing hair in a diffuse all over loss, that is a different kind of hair loss. If you're losing it in a focal area, then we have to ask a couple questions, and this gets really technical. It's more like dermatology. So you're looking, is there scarring or not scarring? If there's scarring, obviously it could have been burned, you could have a genetic birth defect, you could have something that affects that area of your scalp. Those are a little more obvious. If you have a focal area that's not scarring, then that brings up a whole nother list of diagnoses. Those things are pretty straightforward. You come in here with patchy focal hair loss. We go right after that. We're trying to figure out what causes that. Some form of infection, some form of inflammatory condition. We're gonna go at that. So let's talk about diffuse all over hair loss, because that's really the one that drives people crazy. All of a sudden, just boom, all their hair falls out. Or they start losing hair in a distinct area, like across for women, across the central or the vertex of the scalp. And for men, the crown, right? No comment. Or the temples, we get this kind of male pattern baldness. That's hormonal, usually genetically programmed, but then affected by hormones. And as we do more and more hormone treatments, we're battling that battle because it increases the rapidity of the hair loss. And so we're going to break that down into two different types, and we're going to not focal and all over. So let's talk about all over, because that's where most people struggle. Well, before we go into all the different types, we need to talk about hair growth. And hair grows in cycles. We all kind of heard that in our life. Your hair grows in cycles. There are different phases of hair growth. The first and most powerful phase is what's called the anagen phase. The anagen phase lasts 2 to 6 years. Who's last 2 and who's last 6? I think you got to ask your parents about that one, because that's genetic. That's why some people can grow long hair, and other people just can't get it to grow no matter what, because the length of the time that the hair is growing is genetically programmed. It's somewhere between 2 and 6 years. And so if you have hair down to your rear and beyond, that hair just grows so beautifully. You can't just let that happen. You have to have the genetics for that to happen. And that's how long your hair is in an anagen phase, because as soon as some unknown signal comes by, boom, that hair unplugs. The root of the hair is plugged into the blood supply and is growing. When it separates from its blood supply, then it's just a matter of time before you lose that hair. So the anagen phase lasts 2 to 6 years, and then we move into what's called the catagen phase, which lasts a couple of weeks. Catagen means that the hair is unplugged, the growth stops, and the blood supply is separated, right? And then we go into what's called the telogen phase. At the telogen phase, telogen phase, this is the one where all these weird things start happening. Now, 80 to 90% of your hairs are growing at any given time, usually, unless something happens to sweep across your hair growth and your hair follicles and kind of reset a bunch of them. And then all of a sudden, a ton of your hair will fall out. I mean, you just pull it. Grab a handful, and 5 or 6 will come out. You can lose up to 300 hairs a day. All of a sudden, just handfuls of hair all of a sudden in the drain and in the shower. Who wouldn't panic in that situation? So let's go through that telogen phase hair loss and how we identify the differences of those. Now, what's fascinating about telogen hair loss is is that once the hair goes into that, unplugs from its hair supply, blood supply, and is sitting there, it'll sit there as a club hair, is what it's called, as a club hair, just plugged in. I mean, it's just in the hair follicle, a little bit stuck, but not really attached. It'll sit there for 3 to 6 months. Maybe 2 to 4 months is a better accurate number. So let's say you had a traumatic event, right? Something really stressful, some bad infection, a high fever, gave birth to a child, something dramatic happened in your life. Well, 2 to 4 months later, potentially all your hair will fall out. Well, a large portion of it, 50% of it will fall out all at once. But you will be so far away from the traumatic event that you won't put 2 and 2 together. You won't think to myself, well, that's because of this stress, this divorce, this bankruptcy, this my mom got sick and something bad happened, or car wreck, or surgery, or high fever. It was 4 months ago, so it's not on your mind. But a lot of the times when somebody comes in here, they'll bring me a Ziploc bag full of hair to prove to me that, look, my hair's falling out. And I'll be like, okay, I hear you. Let's go over the last half a year and try to figure out what you've been through in the last half a year. And it's kind of remarkable how many times we come up with 1, 2, or even 3 traumatic events that could have triggered that hair loss. And so it's important to know that if you're losing a whole bunch of hair all at once, we're not going to make the assumption that it's telogen effluvium, right? Effluvium is this fancy word, telogen effluvium, where your hair is just coming out all at once, but we could. And so that's what we're looking for, is trying to find something that could have triggered the hair loss, some event that was powerful enough for you to suddenly shock your scalp and put a whole bunch of hairs into telogen phase all at once, and then you have to wait 2 to 4 months for them to all fall out. So they do. So it can seem like everything's great, you know, all the stress is gone, I feel great, I've never felt better, and all of a sudden all your hair falls out. Well, because it's a delayed reaction. It's a delayed reaction. And if you have ongoing psychological stress, ongoing issues, ongoing chronic diseases, particularly liver and kidney, you're going to have a constant assault on your hair follicles, and so you may lose hair for a long time. So don't underestimate the power of psychological or physical stress on your body and what it can do to your hair growth cycles. Now, you can also lose a whole bunch of hair. It's something called anagen effluvium, and you can lose a whole bunch of hair that are actively growing. And that's usually what you see when somebody's on chemotherapy, right? So they're on chemotherapy and all their hair falls out all at once. And it takes months for that to grow back once the chemical agent has been removed. So you got to remove the chemical agent or stop being on it, and then all of a sudden your hair starts growing back. You know, the treatment for that is to wear a wig until it grows back. But telogen effluvium is the biggest thing that we deal with. And another very, very interesting thing is something that's got an unusual name that has to do with how you treat your hair, right? So you can have hairstyles that are too tight, and you can get something called traction alopecia. Alopecia is hair loss. Traction alopecia, if you have it braided too tight, or if you have something too tight on it, you can actually lose hair in the places where it's been pulled, particularly if you have like a square braid or something on the very edge where it's pulled the tightest. You can see that there's a gap where the hair is not growing because it's just been pulled so hard that it comes out. But this is something called Trichorrhexis nodosa. Trichorrhexis nodosa. I'll put it right here so you can see it. Just you can pretend. Basically, the hair breaks due to trauma. Over brushing, over scratching your scalp, too much pressure, too much heat, too many chemicals. And we're talking about chemicals that you treat like bleach and dye and hair relaxers. These are the things that if you do too much of it, you'll just damage the hair. And you get this Trichorrhexis nodosa. So you gotta be careful. You have to treat your hair right. You have to give it a break. You know, they can only do so. It can only take so much. And so it's important to know that if your hair is breaking at the shaft where it's coming out of the hair, it's broken, it's shattered, it's frayed, it's because it's just chemically overtreated and it's been or heated, it's been injured. So too much hot, too much heat, too many straight irons, too many curling irons, too much chemical, all that stuff will damage your hair. You have to take really good care of your hair to stay away from this particular problem. We're also going to check your thyroid. I firmly believe that you should do an in-depth thyroid analysis. You can't just do a TSH. You got to check it all. Thyroid, TSH, T4, T3, thyroid antibodies, both kinds. We really want to know what's going on with your thyroid, and what's called a metabolic panel. A metabolic panel checks kidney, liver, electrolytes, blood sugar. We want to know if your liver and kidney are healthy. That's important things to deal with when you're talking about the health of your hair. All right, so we've determined all that looks normal, and you have what's called the telogen effluvium, the just sudden loss of all the hair, the reprogramming, the reset button got pushed. You shed your hair and it all starts growing back. Typically it grows back within 2 to 6 months once the offending agent is gone. The biggest problem we have is a lot of people live in a total state of psychological stress and they can't get rid of it, whether it's their relationships or their job, and there's a constant barrage of psychological stress. Well, until you end that stress, until that stress is ended, you're going to continue to have that pressure on your scalp. You just will. So that's the telogen phase, Telogen Effluvium. Well, what can affect your hair during the anagen phase? The anagen phase is the phase of growth. That's when it's actually stacking hair and building it. Well, obviously, what do you need to build hair? You need calories, you need protein, you need nutrients. So if you're eating a very restricted diet, or say all of a sudden you go on a radical diet or have weight loss surgery or some kind of ridiculous low calorie diet, which is fine, please. Take care of yourself, get the weight off, that's primary. But when you do that, all of that calorie restriction will have an effect on the ability to grow hair. So your hair will fall out, or it'll appear to fall out, it just won't grow. The hairs will fall out from the stress, from the telogen side, and then they won't grow back on the anagen side because you're not giving it the raw material or the protein and the calories that it needs to build. So be sure you're a protein-holic, those are my people, protein-holic people, and I want you to build or intake enough protein to build your hair. Stress, childbirth, trauma, there's a lot of things. Scalp trauma for sure. So anything that affects your body dramatically, you need those calories to change gears and start healing other parts of your body. Your hair is going to take a hit. So that affects the growth phase and the resting phase of the hair. So finally, I want to talk about the most common type that we deal with in a hormone practice, and that's hormonally influenced hair loss. For men and women, it's slightly different. It's genetically programmed. You're either prone to male pattern baldness, which is M type, or females are programmed to female pattern baldness. And so it's a matter of what we do to do that. It's an effect of DHT, which is activated thyroid metabolite. So at the skin surface level, the testosterone converts into DHT, and the DHT is what tells those hair follicles to become patterned. You know, men, the sides and the back is spared typically, and you get all of this gone. With women, it's a vertex right down the middle and a central hair loss more than it's the temples. The temples are typically spared, but it's the same kind of concept. And obviously, we want to go after it and we want to treat it right. So what testosterone does, and the DHT particularly, is it shortens the anagen phase. Remember, the anagen phase lasts 2 to 6 years, and how long that hair can grow in 2 to 6 years is the length of your hair. Well, every repeating cycle of each hair follicle in the presence of DHT that has been genetically told to go away, the anagen phase shortens. So every cycle, every 2 to 6 year cycle, the next hair is going to be shorter, and the next hair is going to be shorter. Not only just shorter, but also thinner and finer. So the thickness goes away, the skin starts peeking through, raindrops will hit you directly on the head. That's because the hairs are getting shorter with each repeated cycle. Right? So that's an important thing to remember, that this can begin at age 12, all right? But normally it's in the 40s, and by 50, more than 50% of the people that are gonna have this, it's obvious that it's happening. So, but by 50, more than half the people are gonna lose their hair. It's already started to show. Each repeating anagen phase has gotten shorter, the hair has gotten thinner, and it's gotten softer. And so this is important to realize that this is just a natural human thing. It just is. I mean, the only way to battle it back is to get hair transplants. If you have very straight, thin, fine hair, everyone's always going to see your hair plugs. If you have nice curly hair, then your hair plugs are going to be hidden, right? So your hair is going to grow and curl and hide, and so this is important to know. But that's certainly an option, and no judging. I think everyone should do what makes them happy. But we need to realize that this is a natural human phenomenon for men and women. But that doesn't mean we can't fight back. So what is the most powerful weapon against this kind of hair loss? You've all heard it. You could go to the store right now and buy it. It's called Rogaine. Does Rogaine work? Yeah, it does. It takes forever, and you have to use it forever. Once you start taking, or if you're going to battle this, you have to apply the medicine every single day, continuously, indefinitely, and that's the only way you're going to get to a point where you get your hair to resume its normal growth. And it'll never be normal, but it'll certainly stop the problem. Now for men, for sure, for men, we use something called finasteride. Finasteride does show effect in men. It does affect some other things, particularly on the prostate blood test side, so we want to watch that. It actually helps detect a change in prostate numbers, but it's a whole long discussion we would have in the office because it's a prescription drug and we want to talk about it. We have been known to use that in women at times. It's certainly not the norm, but we do use it. In women, we use something else called spironolactone. Spironolactone has been shown to have a modest effect on hair loss in women. It affects the scalp at the DHT level. So those are the things we're after. There's not a lot of other things. We use, in the clinic, we use a lot of B vitamins like B7 and B5 because that has been shown in some people. And I think that's because B vitamin deficiencies are rampant. Now, does it work on everyone? No, but it does work on plenty enough people for us to use it and try it and throw it at it because we want the hair to grow back. So once you know that, once you've looked at the hair, once you've felt the hair, once you've examined the hair, once you've done the labs, once you've seen the patient, once you've talked about the pattern, once you've discussed the hormones, when it comes down to it, for most people, it's either stress-induced telogen effluvium, and that's just going to take time, and that's reassurance and watching. Certainly taking supplements that may help you grow hair and making sure that your protein intake is appropriate. Those are things that you should be doing. If it's hormonal, male or female, we need to talk about the treatment options for that. There are things we can do, and certainly when we're giving you hormones and making your hormones go up high to the optimal level, it's going to accelerate the hormonally induced hair loss if you don't battle back. So you need to battle back and you need to be prepared for that. So it's an important thing to deal with. But we all, or the majority of us, are going to be dealing with this, right? If you're just lucky and blessed to have this beautiful hair over time, well, congratulations. But guess what? It really doesn't matter because we want to make sure that we do what we can do and fight the battles that we need to fight. Anyway, that's hair loss in a nutshell. There's a whole bunch involved here. It's a way more complex thing than people think when they just throw that out there. Hey, give me something to make my hair grow. But we'll work it up. We'll figure it out. We'll help you. So come see us at the Davis Medical Group if you need help, or Body Goal MD. We're happy to help. Have a great day. Dr. Davis, East Texas. Bye.